my name is EEG Steingold. I'm a Chief Science Officer at JELIKALITE, and I would like to talk today about the new treatment modality that has all of us excited. It's transcranial photobiomodulation and how we use it to reduce symptoms of autism. So first of all, I would like to say a huge thank you to Brain Foundation, of course, and to people who have been advising us, guiding us, contributing to our research, collaborating with us, Professor Anguero, who is helping with EEG analysis, Professor Fratkin, who was the PI on our studies, Luis Di Tabada, who is helping us with the device, Professor Nazer, and Professor Navia for their contribution and their help with understanding how autism works and how mitochondria works and how this specific treatment could be actually the match made in heaven for this condition. So I understand that this is a very sophisticated audience, but still very high level of what tPBM is and why it could be helpful for autism. So transcranial photobiomodulation is non-invasive. That's something that has all the parents excited. It stimulates brain with pulsed near infrared light. Doesn't have to be pulsed. We do use pulsing. And when you stimulate the brain with near infrared light, several things are happening. First of all, there is an increase in cerebral blood flow to the brain. There is also activation of mitochondria to produce more intracellular ATP. And what happens when more intracellular ATP is produced, the cells are being healed, and this specific modality in infrared light has been shown to reduce inflammation in tissue. It's even approved by FDA for reduction of inflammation in tissues, not in brain tissue, in other tissues, but still. And there are some preliminary findings with EEG and MRI that shows that this specific modality could improve brain connectivity, which is exciting for autism, as I'll talk about it later, but imbalance in connectivity could be one of the underlying reasons for autism. So again, what's happening when you apply laser or LED to a person's head? It actually penetrates the skull and it's reaching brain tissue, and the light is being absorbed by the cell, which there is a very complex chain of events, but the end point of it is that the cell's mitochondria is activated to produce more intracellular ATP, which is energy for the cell to heal. And what's happening is the tissues are being repaired, and synaptogenesis is improved, and eventually brain connectivity is being improved, and functional brain connectivity is being balanced, because when you stimulate several brain areas simultaneously, you can balance, you train those brain areas to respond simultaneously, and you basically achieve balance and functional connectivity, you achieve more coherence. So there were quite a few studies in other conditions, and that did show with aphasic patients, for example, that word production, language production has been improved. There's been shown improvement in memory, mood, and sleep, specifically in studies done by Professor Nazer and her colleagues. So why we believe that autism could be specifically incredibly susceptible to this type of brain stimulation of near infrared light? So first, let's look at the causes of autism. And of course, again, it's a very sophisticated audience, but we all understand that this is an extremely complicated story because it's a multi-causal condition. There is a huge genetic component. We know that chromosomal deletions, chromosomal duplications could be involved. There are many de novo mutations that are involved. We also know that not every child who has certain genetics susceptibility, not every child would have this expression of genes in the condition. Other factors, environmental factors, play a huge role, including maternal exposure to pathogens during pregnancy, maternal autoimmune disease and inflammation during pregnancy. Sometimes you have a child with brain size abnormalities or morphological changes in the brain. Specifically, new studies show that cerebellum is being affected, and it's smaller in children diagnosed with autism. Quite a large proportion of kids diagnosed with autism have also mitochondrial dysfunction, and many of them have full-blown mitochondrial disorder. Recent studies show that there is a neuroinflammation in the brain, including and most inflammation of glial cells. This is becoming even more complicated because right now we don't have established biomarkers for brain inflammation, for neuroinflammation, but this is where research is now. This is what people are looking at. There is also synaptic imbalance. There is imbalance in excitatory and inhibitory connections, and there is functional connectivity imbalance, so coherency imbalance. So areas that should be working together don't respond together, and specifically there is long-range underconnectivity. Some studies show short-range hyperconnectivity. In any case, there is imbalance in connectivity. And all these causes are interconnected, or at least some of them are interconnected, some of them independent. And I just want to say that this treatment that we are looking at is not going to affect all of those causes, but it will affect some. So, of course, it's not going to affect genetics, and it's not going to affect a child's previous history. So when a 4-year-old or 6-year-old comes to receive this treatment, his story is already established. Whatever exposure to pathogens happened, it already happened, and his morphological changes in the brain or connectivity imbalances that have been established, they are already there. However, some of it we could be helping with. For example, if there is underlying mitochondrial dysfunction, this treatment would help with intercellular ATP production. This treatment would reduce underlying inflammation. And potentially, when inflammation goes down, connectivity and even synaptic imbalance could be helped with this treatment. Now, why this treatment is not miraculous and why it takes time? Because even after inflammation goes down, there is still connectivity issues that needs to be addressed. And that's why my observations show that this treatment works great with an additional therapy, behavioral therapy, with some kind of synergy is needed to train brain, in addition to reducing inflammation and helping ATP production. So just to summarize, near infrared light can reduce inflammation in macroglial cells. And one way to look at it is through brain waves. So there is research that shows that delta waves are very interesting, specifically because they're usually associated with deep sleep. However, when there is a neurological condition present, such as schizophrenia, for example, or when there is some kind of delirium that the person is in, the brain also emits a large proportion of delta waves. Interestingly enough, we see, and I'll show this data later, we see that our trial participants also show abnormally high presence of those delta waves. So looking at the changes in these delta waves over the course of our treatment could be a proxy for looking into this brain inflammation process. In addition, we know that gamma waves are associated with learning and memory, and I'll show you later that what we did see in our participants is that the proportion of gamma waves, the intensity of gamma waves has increased over the course of our treatment, which brings us to the efficacy of our device. Our device is Cognilum, and I'll talk to you about it right now. So you see a very good looking boy. This is Anthony, and he's wearing a prototype of our device. I just want to say that our studies are IRB approved. This device has received a non-significant risk designation from the FDA. And in addition, based on the result of our first study, we received Breakthrough Device Designation from the FDA. So I'm going to talk very briefly about our first study, mainly because we did talk about it before, but it's a nice transition to our current study, so I just would like to remind people about it. So we looked at whether our device would be safe and effective in reducing symptoms of autism. We also looked at EEG. Could it be helping in detecting children's improvement? And we evaluated improvement by looking at Childhood Autism Rating Scales. We looked at the scores before and after the course of the treatment. We had an active condition and a sham control condition, so it was a randomized double-blind study. And to collect EEG, we looked at 64, we used the device that looked at 64 channel medical grade EEG. And in addition to childhood autism rating scales, every week we interview the parents about child's improvement or maybe intensity of child symptoms. Maybe somebody's symptoms became even more intense. Just be mindful that these parents, while we interviewed them, didn't know the condition of their child. They didn't know if the child was receiving treatment or not. So here's what we found. Okay, so you can see these are the orange charts that show the active group. You can see that there was a significant reduction of CARS score in the active condition. If you look at the blue bars, this is the placebo condition. There was a very mild reduction, about 2.5-point reduction. This is the placebo effect, but it wasn't nearly as strong. We had almost 9-point reduction in the active effect. And the difference between the groups is statistically significant. So if you look at EEG data, it's also very interesting in that if you look at the orange line, this is the active group. If we look at the blue line, this is the placebo group, and this is the delta waves. These are the delta waves, which I was talking about earlier. And if you see that, then you'll notice that for the kids who are orange, the intensity of their delta waves goes down from one session to another. Whereas for the kids in the blue condition, the placebo kids, the intensity of their delta waves stays exactly as it was in the beginning. And again, a reduction of delta waves could be a potential cue or indication that brain inflammation is going down. We also looked at the correlation of reduction of delta waves for all the kids, whether in placebo group or in active group, and the reduction of their CARS score, because some kids improved even in placebo group. And you will see that the correlation is very strong, statistically significant, which shows that for kids whose CARS score went down, whose childhood autism rating score went down, for those kids, the intensity of delta waves also went down. So the kids who are down there, whether orange or blue, these are the kids who are doing great. And the kids who are up on the right corner, on the right up corner, those kids do not so well, and they have a lot of delta waves. They also have very high CARS score. And so again, we have a statistically significant strong correlation showing that these are the kids, the delta waves, their reduction goes well with the reduction in CARS score. Another interesting finding from that study is that change in delta, we saw it by day 14. So 2 weeks into study, delta started dropping for the orange group. Why? So it shows that change in delta is often detected before the parents notice changes in behavior. Because changes in behavior were observed by week 3, sometimes by week 4, for some kids even by week 5. But by week 2, EEG already showed that delta goes down. So this is our previous study that has been completed, and we're writing it up for publication now. I would like to tell you now about the study that we're doing right now. Not every child is completed, so the results are preliminary, but they're extremely interesting. We see we are running 25 participants. 15 of them have been in our first study, and 11 of those 15 kids happened to be in placebo condition. Not happened, we invited them to now come back and receive treatment through our open label study. 4 of the children have received the treatment before, but the parents really begged us to repeat it, and we wanted to see what's going to happen after repeating the treatment, so we invited these 4 kids. The interval between first and second round for these 4 kids was almost 6 months. And all these kids are from 2 to 7 years old. Again, we used childhood autism rating scales before and after. Each child went through 15 minutes of EEG collection during each session. So the child comes to the office, for 15 minutes we collect the EEG, and then in addition, they get up to 15 minutes of brain stimulation of the infrared light. We also try to reach out to kids' speech therapists and to get some independent observation to see what the therapists are noticing, because many therapists don't even know about the trial, and the parents are so biased and so excited that we wanted to be careful. But we still, of course, interview them every week. So this is the reduction of childhood autism rating scores. Please be mindful, this is open label study. The parents knew that the children are receiving treatment, and we also knew that each child is receiving treatment. Still, it's a statistically significant reduction. It's very robust, and it's a replication of our previous double-blind randomized controlled study. Now, if you look at the EEG data, then it's even more interesting. Again, we see a statistically significant reduction in delta waves. We also see a statistically significant increase in gamma waves. Now, if you look, there is more than 60% of brain waves that's on average, that's delta, which is abnormal, and in the beginning of the trial. And you can see how little gamma is present there. As the trial goes on, of course, there is still mostly delta, there is very little gamma, but there is a trend in the direction that we want to see. So this is very interesting, statistically significant, but what it actually means for the children, for the parents, and for the therapists. So I would like to talk to you about Miles first. He's a 7-year-old boy, and he received 2 rounds of treatment. He came functionally nonverbal. At 7, he knew less than 5 words. He was sometimes using them, but other than that, he was nonverbal. And after the first round of treatment, he started gesturing. He also became more present. And this is something that most parents are telling us. He's suddenly aware. He knows what's going on around him. And his vocabulary improved more than 10 times. After 2 rounds of treatment, now he's having definitely more than 100 words. He is using them functionally. He can ask for food. He can tell no more. He can ask for help. When he's fastening his zipper, he says zipping. He is using those words functionally. And in addition, according to his ABA therapist, he is enjoying his therapy now. He's more engaged and he's participating more, which makes the therapy sessions enjoyable, not only for Miles, but also for his therapists. Actually, now I would like to stop, and I would love for you to hear from a speech therapist. She was an independent observer, not connected to our company, not connected to our trial. We simply asked her to volunteer and come before we started treatment and after several kids completed the treatment, just to give us an independent eye. And she evaluated Miles as well as some other kids. So let's hear what she has to say about the improvement that she observed.
Hi, my name is Julie Crutoy, and I'm a speech-language pathologist in the states of New York and New Jersey. I'm an independent evaluator for the JELIKALITE trial. I have not been paid for my findings or my services. I was there just to evaluate the children before the treatment and then again after the treatment to detect any differences in their language skills. So my overall findings, I found that the children have made an overall improvement in their expressive language skills. I found that about half of the children began to combine words, and others started to use new words. A lot of parents, as well as myself, reported and noticed that the children are becoming more aware of their environment and of their surroundings. They're more responsive, they're more alert, and open to communicate. There are 3 children that were particularly stood out for me, so I would like to discuss them. First would be Daniel, who was 4.5 years of age at the time of the trial. So prior to the JELIKALITE trial, he was able to use 1 to 2 word utterances. When labeling common objects and pictures, he was able to use some verbs, and he followed 1-step commands. He was, however, extremely hyperactive during the evaluation, and he needed multiple accounts of redirection from myself and from his parents. However, post-treatment, he was able to produce 2 to 3 word utterances. He used a lot of descriptive word concepts, such as dirty and clean. and he was much more alert and aware. He was engaged with me. He responded to what and where questions, and I did not need to redirect him at all. Then we have Miles, who was 7 years and 2 months at the time of the trial. So Miles was, he did not really face me during the evaluation. He demonstrated poor in-seat behavior. He did not respond to me multiple times when I called him. It was really hard to engage him, and I heard him say help me one time, and his dad did mention that he has some scripted concepts, utterances that he uses, like 1 to 2 words. However, after the JELIKALITE treatment, Miles sat in the chair the entire assessment. He responded to me consistently. He responded to his name. He initiated eye contact several times. He said, "I want car," independently a couple of times during the session, and then he demonstrated joint attention with me. We were looking at a book. I asked him, what does a pig say? What does a cow say? What does a horse say? He responded consistently and appropriately. His parents also said that they see a huge difference at home in his language, and that he's beginning to respond to questions as well. Finally, we have Jason, who was 7 years and 9 months at the time. Jason is essentially nonverbal. He did not imitate any sounds, words, syllables upon request. However, after the treatment, he imitated many, many words and models that I gave him upon request. He imitated "give me" several times when requesting objects. He had some articulation errors. However, he was able to imitate all the models that I gave him, and his parents did also report that he is much more open to imitating words and is imitating words at home, which is great to hear. So overall, I would definitely recommend this advice, and I only saw positive things, and I hope to see good things from it. Bye.
So I would like to talk about Jason. Julie talked about him, what she observed. This is what we've seen after the first round of treatment, and he completed only 1 round. So like Julie said, by the end of the treatment, he started imitating words. He also started answering questions, and he was able to say, "give me." This is a 7-year-old boy who was nonverbal prior to starting our trial. In 2 months, 8 weeks, this is the progress that we've seen. Just notice how fast it is. And now I would love for you to hear from Jason's parents. And this testimony, they give us in the beginning of the trial, about 3-4 weeks in. Why is it interesting to us? Because they talk about the changes that most parents observe very soon into the trial, before the speech comes. They will be talking about changes in his behavior, in his focus, and in his responsiveness.
Hi, this is Jason.
And we recently started with Cognilum. We're happy to report that Jason has been showing lots of improvements. His teacher has told us that there's a lot more focus. He's willing to do non-preferred activities. So that has been really nice. At home, there's been a lot less tantrums, right, Jay? He's been a good boy. So we love it because it's non-invasive. It has no side effects. It's quick, it's easy, it's simple. We've tried prescription medications before with little success, lots of side effects. So this makes it a lot better for him.
Yeah, we're looking forward for the next couple of weeks to see his continued progress. So thank you. Jay, say bye-bye.
Jay, say bye. Bye.
Okay, so another little boy, this is a 4-year-old boy, Ethan. He also came to us nonverbal. He was able to say less than 10 words. And this is from his school teacher. He goes to a special school that provides ABA services, and she noticed how fast he's learning. She said that to teach him to request each new thing, it used to take her 3 weeks, sometimes 4 weeks, to teach him to request milk, 3 weeks, to teach him to request a candy or a cookie, another 3 weeks. And then suddenly he's just learning to request things. He just learned how to say, "I want," or "give me, please," and he's asking for whatever he wants. In addition, the teacher noticed his focus, responsiveness, and by the end of the trial, he's almost done. He's still in the trial, but toward the second half of the trial, he started repeating words and saying his name. So his therapist was so excited that she made a video of Ethan during the therapy because it's such a marked change. He used to be hyperactive, not focused, and not responsive. And now she's excited because he's sitting down and he's learning.
Who's this?
Mommy.
Good job. Who's this?
Appa.
Abba. Who's this?
Eater.
Eta. And who's this? Yaakov.
Yaakov.
Good job. You want chocolate? Ask me.
Eat chocolate.
Chocolate.
Chocolate. Good job.
Okay, so I would like to talk to you about Logan, another 4-year-old boy. He completed 2 rounds of treatment. So he was one of those 4 kids who came first. There was a marked improvement. Parents were so excited that they begged for us to do the treatment again, which we did. And so he came to us nonverbal. After 2 rounds of treatment, now he speaks with words, short phrases and short sentences, and he's using language appropriately. So you're going to hear from his mom after the first round of treatment, after the first 8 weeks.
One of the benefits that we've seen with Cognilum is the fact that after a few weeks of use, there was a marked change in my son's communication. Where things like therapy that we've used in the past can take months and even years to see a difference, it was great to try something where we saw a difference in a shorter amount of time.
And now I would like to talk to you about another 4-year-old boy, Wendell, who also came to us nonverbal. He's still nonverbal, but he is now saying mama, and he's using it appropriately, which is, of course, very exciting for his mom. Everybody's emotional that he says mama now. But his changes are mostly in the area of behavior. He was extremely hyperactive, throwing tantrums, not being able to be social with others, and not responding to directions. And this mom noticed big changes in those areas.
Hi everyone, my name is Sarah. I am mom to 3 children. My son, who is 4 years old, who is the last child, was diagnosed with ASD May of 2020 during the pandemic. He had a lot going on with him as far as behaviors, not being able to be potty trained, not social at all, and nonverbal. Wendell started JELIKALITE about 2 months ago, and he is thriving. Besides being nonverbal, Wendell is now social. He is playing with his siblings, which he's never done before. Wendell is following directions in class. He's participating in academics, which he's never ever done before. We're past the stage of Wendell being hyper. He is completely potty trained. He has no behaviors, and he is social. He's thriving, and we're, waiting on him to thrive even more academically and get some words coming out. But I can say there has been a big change, turnaround, and progress with Wendell doing the case study with JELIKALITE, awesome non-invasive treatment that has come about, and we're grateful for it. Wendell has a few more sessions to go, and I'm crossing my fingers with the progress he's doing, where we can't wait for him to talk. There's hope. The treatments are working, and I can't wait for other people to benefit from JELIKALITE as well. Bye-bye, everybody. Thank you, Dr. Steingold.
So I can't show you all testimonies from our parents. We have many more. We have children who became potty trained, children who started eating independently using utensils, children who started following directions, but of course, most exciting for us, children are using language, and this is something that we always love to see. So what are we going to do next to this? Well, we could start simply giving this device to functional medicine doctors, so integrative medicine doctors, to be used in their practice for pay. We would love to cooperate if anybody is interested in short investigator-sponsored trials for all the pediatric population. We have looked at children up to 7 years old. We're really excited to look at older children. If anybody is interested in cooperating with us, collaborating with us, please let us know. We're also preparing a large clinical trial. Hopefully, we'll be able to start in early 2023 to receive FDA approval, and this will be with young population, and this will be double-blind, placebo-controlled clinical trial. So these are the directions where we're heading to, and again, we're looking for partners, we're looking for collaborators. Please let us know if you're interested. So again, I would love to say a huge thank you to our amazing team, to our academic advisors, and to Brain Foundation for sponsoring us, helping us, and guiding us throughout this process.